Thank you, Ryan, and thanks to all the panelists for telling us a bit about these complementary ways of doing testing, and I think it was a really interesting diversity of options as well as different ways these programs are set up and some of the different considerations. So, so we've got about 15 minutes, over 15 minutes for questions, so I'd encourage anyone to come up and ask a question. There's a microphone over there. Yep, sure. Is it okay if we just talk? Yeah. Okay. Okay. All right. We'll have a roving microphone. Thank you, Nate. Yes. Nate Lachowsky, everyone. Yes. Okay.
Yes.
There we go.
So 2 small questions. For the requisition process, is it just that by making an account you can print one off?
I think I'll stand up here because I'm otherwise hiding behind the monitor. Yeah, so you first create your account, then you have to then create your lab form. So it's actually a few steps. It's a 2-part assessment questionnaire, and then there's a consent to testing page. So there's a number of statements that you kind of read through and check off that you understand them. Okay. And then you get your recommended tests, and you can select or deselect any of them. And then you get your requisition. So you can print it off. It used to just be print only, but about 1.5 years ago, we moved to electronic as well. So you can kind of like boarding pass style, bring it into the lab and have it scanned.
Okay. And then my second question is, so with the partnership with Life Labs, the location of the lab would be a limitation in access, correct? So in terms of like rural and remote communities, let's say up north, they would still have to have a Life Lab to be able to use the service?
Well, that's kind of the main impetus behind us wanting to start working with other labs. Right now we contract with Life Labs to do that collection and transport, and we pay them for that service. But we have started talking with health authority labs, also with the Valley Medical Labs that Maja had mentioned. And then to get into the more really rural and remote communities, I think we'd really have to start looking at those alternate methods, like perhaps mail-based or probably courier-based specimen collection kits. Yeah.
Cool. Thank you.
Yes.
I'd like to know, for those that do point-of-care testing, how are you going to approach the changes in January with the how do you say it in English? How community organizations will be able to do the point-of-care testing without a nurse?
So I think talking about the new approval for directions of use for the Insti or rapid test, that it can be administered by a non-healthcare professional now. That's the question.
So is that, sorry, just to clarify, is that the change that's coming? Is that it will be licensed for use by non-healthcare professionals? Yeah. That's great.
Yeah. It's been announced, but it comes into effect January 1st.
Okay. Is there anyone who wants to speak to that on panel? I mean, that sounds like a great thing. So, a great way of improving access.
Same.
Yes.
Ryan, you go first.
I'm going to come up. I don't think so. Is this on? Yes? Okay, sorry. I'm generally happy for any kind of alternative options. I think for me and what we hear in community is people want as many options and testing options as possible. And so some people want to come into a clinic and have a support person around them, and other people want to test at home. And I think having options to meet as many people and make it as accessible as possible is just great for everybody. So that's my thoughts.
Maja, you want to add something?
Yeah, and I'll just add, with point-of-care testing in our region, we have been working hard to try and actually partner with non-healthcare professionals already to try and, it's a partnership, so the nurse is still the owner, I guess, of the program, but with I don't know if that's not the right word, but you all understand what I mean. I think that with a change and expansion of who can actually utilize the testing kits, we'll be supportive in whatever way. What we need though then is easy access for people to get confirmatory testing, and that's one of the reasons why I think that the program that I talked about has value, because it actually it's opened up that for a non-healthcare provider to make sure somebody can actually get into a lab for a confirmatory test.
Thanks. I think there was a...
Here.
Oh,
Hi. So I know we're talking rural, urban, but my question is around how do we encourage IBPOC populations to get access to that? It's great that we're going to have rural areas such as life labs and so on. And you talked about how you're trying to create more access to the 519 in Toronto. But in the Sex Now survey, we see that about 30% of the people who access services are IBPOC. So what are your thoughts on reaching out to more IBPOC people, particularly in the rural areas where there's more stigma around access to testing?
I mean, I'll say just briefly, I think for us, we're interested to evaluate, what we found in Sex Now 2018 is that we saw less DBS uptake in some of those communities. And so I'm interested to see whether the mail process might be different or not, but it's something that we're going to try and evaluate at least. And Ryan, you talked a little bit about consultations specifically.
Yeah, so again, this is an urban issue, but I do think, or in Toronto anyways, but some of the work we're doing ongoing is we brought on through the PIAC Alliance project community trainees, so brought on a trainee to work with these point of care testing project to look at the evaluations, but also to look at the demographics of who's not represented and who's missing and who's not coming in, and to try and further assess what can we be doing to increase engagement, or and if that is at ACT or if that is somewhere else, I just think it's nice to know about how we can better serve broader communities. So that is some of the ongoing work we're working on.
Great. Yes.
I'll hop up. It's
Hi, Tom.
easier. Get checked. Operates heavily on having access to the internet, tech, cell phones, etc. As it grows, and I've checked in over this, into I'm on our island, so traveling into some of the areas I'm in, having internet isn't common. Is there any hope on offering something else, such as a call-in or something? And older generations aren't as hooked up as some of us are. So even in urbanized areas, chances are that there's a chunk of MSM to having ever heard of this, or they've hopped on, try to enter and all that crap, and end up turning it off. So I'm just curious as it grows, as all of us are hoping it'll take off, is something other type of act that's happening.
Great. Do you want to talk about that one? I mean, that's a great question in terms of raising the notion of that digital divide of, like, you know, people who may not have access to the technology, or, you know, or people who do but maybe don't have the skills, and or maybe it's just they're just not comfortable working in that online environment, which I think is great because it also plays, I think, what we're hearing about sort of these continued barriers that we need to keep thinking about. I can talk about that if you want. Devon, I mean, Devon and I work very closely together on Get Checked Online. I think, you know, it's quite interesting because when I first started working on the project, like, I'd immediately sort of been like, oh, this is only going to work for a certain niche of people. And I was really challenged in that thinking about, like, you shouldn't just be assuming this is just going to be for folks who are tech savvy and design it that way. You have to be thinking about these barriers and these divides. And I think we still have work to do in getting at that. I mean, one of the things that we're interested in trying to explore is the idea of, like, is this a platform that you can adapt and use in other ways? So, you know, there are, some people may know that there are services that you can pay for where you get sent a kit to home, for example, with instructions about how you collect the results, and you send it back and you get your results. So there are ways potentially they don't necessarily involve that sort of like going online in that piece, that are also sort of like complementary methods. We're not quite there yet, but those are the kinds of things that I think we need to start doing. And certainly what we've heard is that in many sort of, you know, particularly in more rural communities, that these are really the kinds of questions that people are asking. So I really appreciate that comment because I think it's a very important thing to think about.
Hi, I'm Jazzy. Thanks so much for your presentation. I just want to celebrate all of the different strokes for different folks. It's a very diverse strategies that have been presented today insofar as making testing more accessible for people. My question, I think, has already kind of been asked, but I'm looking at more from like the promotional standpoint, and being an outreach worker myself, I'm wondering if there are any efforts towards doing outreach into those population groups, the racialized population groups, maybe even translations, et cetera, so that it is more accessible and we do get into those hidden populations as well in the rural communities, because there's lots of MSM in the rural communities who are just not even seen, right? They're hidden, and yeah, great that they can drive half an hour down the road to a different life lab so that they're not seen by their community members, but is that really making it accessible, and how can we make it more welcoming for folks to actually participate in testing? Because that in and of itself, like a half-hour drive away, can be a barrier for some.
Maybe. Is this on?
Yes.
I'll speak. I'll be the one to speak about rural communities. I agree with you that we have done a pretty okay job of getting the message out to some populations. So that's probably the one thing where I would say, aside from looking at, is there a way to expand our on-demand program to more tests? Because that's definitely something we think it would be of value, and we hope we can move towards. Most certainly getting the message out more broadly is something that is important. It's not been our focus up to now, but I appreciate the comments, and I think that especially remembering that that even if we're trying to get into a rural community, it's not about just putting out the same message into the rural community. It's about thinking about who are the people in that community that may get the message, but who might not get the message. So I appreciate the comment, and something that I'll definitely take back to my team for some more conversation, especially maybe our communications department as well, because I think we have some work that we could do.
Does anyone else want to comment on that? Yeah.
Yeah, thanks again for the question. This is probably actually something maybe more that Mark would be better to talk to, but part of the research that he's conducting is going to be looking at modifying Get Checked Online to reach like minority populations. So we will be translating the website and the full application into simplified Chinese and Punjabi, and then working with those populations, specifically in the Fraser Health region, to really look at, you know, is this a service that they would utilize? How does it have to be modified to make it, you know, comfortable for them to use and safe? And then, yeah, so that's going to be a part of the research. It's not going to happen right away, but over the next couple of years, we'll be doing that work.
Yeah, I think we know from the data that we're not doing a good job of like people who are from visible minorities or racialized minority groups who are using Get Checked Online, so we know we have work there to do. So I guess we probably have time for one more question. Okay, we can do...
Okay, sorry. Quick question for express testing. So as the number of repeat testers is increasing, are you finding, or do you think that people are, you know, they know that they have to say no to all the questions to get a fast track to a test? Do you think you're going to have more people, or have more people that are doing that?
For the people that come back, for the people that come back for express testing, it's mostly anecdotally, because we haven't done any research about if people really like the service and what their background is. So it's mostly anecdotally that people prefer the service, have a shorter waiting time, easier access to the service, and it's more tailorized for what they were looking for.
Do you think they're going to lie just to be able to get that?
Sorry?
Do you think they'll lie so that they can get that?
They just answer no.
No, I don't. No, I don't think so. Because I asked several. Probably we've seen before that people are trying to get into express testing, so they have a quicker access. But when they answer the questions, and that's why we ask the questions online. When people come into the clinic, we ask the same questions again. And when the phlebotomist is seeing the client, he's asking the same questions again. And if there are questions, then the person simply doesn't qualify and is redirected to see a nurse. So we've experienced that, but it's not a big number who's trying that.
I have a really quick question.
That's all right.
It's also for express testing. I'm really interested. I'm wondering if it's in and out in 15 minutes and it's always booked and there's repeat tester, are the spots limited to 7 to 10 days, where I think somebody could probably have
Okay, at the moment we have like 2 appointments per hour. Each appointment is about 15 minutes. The phlebotomist is also assisting the nurses with blood draws. So hopefully in the near future we have more capacity to do more express testing and offer it to more people. But it's absolutely something to reconsider. Thank you.
Great. So I want to thank the folks here in the room. I appreciate the questions asked and really helped to further our discussion about really doing even more that we can do to address some of these inequities in access to testing. And I really want to thank the panelists for sharing with us, and I'm sure that they'll be around to answer any more specific questions you may have about the programs. With that, we are finished. So thank you very much, everyone.